They are shortened like PROTACs. And PROTACs is actually a molecule that can pass the blood-brain barrier if the linker arm is not too long, and it can also pass into the nerve cells. And much of the production of amyloid beta or tau is produced intraneuronally. So it has, I can see it as a complementary treatment to the established antibodies that we get now, coming now several against amyloid beta. But the effect size is not optimal. I mean, the decline is a bit reduced, but we had expected more, to be honest. And I think we have to do a combination treatment in the future, and this small molecule seems very promising. I've actually got that from the idea from cancer treatment. PROTAC is a rather new entity that was described like 20 years ago, but it has now become to be established as a treatment of metastatic prostatic cancer or metastatic, I would say, breast cancer in women. First of all, PROTACs is a molecule that really goes inside the nerve cell also, and then one part of it adds to the protein that should be degraded, and then there is the linker arm and another part, an E3 ligase that will stand for the ubiquitination. That's a way that the body gets rid of waste products, waste proteins. You have autophagy that got the Nobel Prize, that research, and you have ubiquitination as two ways of getting rid of waste, we could say. Yeah, first of all, we have to develop the PROTACs suitable for humans. And we can certainly look for different libraries, get different PROTACs that are developed, but it's very much also to construct a molecule that links the E3 ligase and the protein and the binder in between. And to do that, you need knowledge as a medicinal chemist, I would say, to not make the arm too long and not too short, and give the molecule the right direction. And then the advantage with PROTAC is that when PROTACs go inside the nerve cell and do the trick to take away abnormal proteins like tau or alpha-synuclein in Parkinson's disease or whatever neurodegenerative disorder you're approaching, then the PROTAC is making the trick, take away from the molecule the binding part, and then it's like a circle, it's coming back again and take a new molecule. But the tradition we have is that one medicine goes in and then it's stuck in the interaction. So now what we hope is we can use lower concentrations of PROTAC than we can with traditional approaches, because it is, what should I say, vicious circle, coming back and doing the trick again. So it's a very, very nice method, and we have taken that from the experience they have in cancer research. Yeah, because, as I said, I think it's important that we don't need to add so much of the molecule, because molecules have always side effects. And now I estimate that the side effects will be much lower due to the low concentration we need of PROTACs. So there will be an effect both on having a low concentration, it will be cheap. It's a cheap small molecule that is accessible, easy to produce, and it will be fewer side effects. Of course, it's much work to do to see that it passes in and goes to the right regions of the brain, because we know, for example, regarding tau, that tau advances in a specific manner. It's like virus infection in the brain. One region is struck in early stage, another one is in moderate stage, and a third one in severe stages. So we have to, it's a lot of basic science left before we can go into man.